Before you start Depakote, you need to check certain blood levels, the liver enzymes through ALT and AST, and platelets through a complete blood count. This medication can affect the bone marrow, cause weight gain, lead to liver problems if used at too high of a dose. So it's important to check these labs before starting and periodically while on it, which I'll discuss more at the end of this video. So Depakote is a good medication for use in the hospital or emergency situations because it works quickly, maybe in 1 to 2 hours with a peak in 4 to 5 hours. For people with a history of manic episodes, this is a good choice as it reduces how often manic episodes will occur in the future and how intense it will be as well. And if you've seen a person in a manic episode, they can be super difficult. They can get aggressive, talk a lot, not be able to mind their own business, even get psychotic or reckless. Depakote is also called valproate, and the stomach converts it to an acidic form, so it's often seen as valproic acid as well. And you dose the medication typically based on one's weight or what it's being used for. If it's for bipolar disorder, it'll need probably doses of at least 1,000 milligrams a day or up to 2,000 milligrams. After about 5 days of taking the medication, you'll notice the optimal effect, so the Depakote level should be checked in about 5 days. This can be helpful to make sure that you're not using too high of a dose or too small of a dose, and also whether or not the medication is taking as being prescribed. There are forms of Depakote that work quickly, like within a few hours. There's also a long-acting version in which it's just taken once and thought to last about 24 hours. There's also a sprinkle formulation where it can be mixed with sauce or pudding. It may be good in people who cannot swallow pills. And there's a liquid form as well. And Depakote is thought to have a calming effect on the amygdala region of the brain. This is why it can be helpful in cases of anger or mood swings and post-traumatic stress disorder. So PTSD victims that can get a lot of anger, snap, have ferocious mood swings, and Depakote can help calm that part of the brain that is causing those reactions. It can be sedating, so you can take it at night, which will be particularly helpful for people with bipolar disorder, in which if they're not sleeping, it can lead to a manic episode. In cases of agitation and dementia, I may start as low as 125 milligrams 3 times a day to as high as 250 or 500 milligrams 3 times a day. Dementia patients may have lost their ability to calm themselves down if they get upset or frustrated, so the medication here can help serve that purpose. Depakote is also a medication that's helpful in seizures and headaches. It's recommended to not use with another medication called Lamictal because it can more likely lead to a rash in Lamictal. So typically one or the other medication should be used and they shouldn't be used at the same time. How does it work? We're really not sure how Depakote works, but it's thought to increase the activity of GABA, and GABA is a molecule that helps to calm down the brain and nerves. The side effects of Depakote, again, it's usually pretty safe, but can be pretty extensive. As shown here, I have a few diagrams which list some of the side effects of the medications. In particular, it should not be used during pregnancy as it can affect the brain and spinal cord development in the fetus during pregnancy. Again, here are some more images of side effects of this medication. And lastly, it's important to monitor the blood before starting. Here are the indications of when to check it after starting the medication. So if you liked this video or benefited it from any way whatsoever, please subscribe to the channel. It doesn't cost you anything and it'll help the channel grow.